More than ever, we're hearing that people with long-term conditions want greater understanding and involvement in decisions about their care. So what does this mean for the NHS and for patients? My name is Dr. Stu Farrimond. I studied medicine and enrolled on the GP training scheme. But a few years ago, I was diagnosed with a long-term condition, brain tumour and epilepsy. So overnight, I went from doctor to patient. The Government and Department of Health have set a clear priority to put patients at the centre of their care, giving them more involvement and choice about their treatment. You may have heard a lot of terms such as personal health planning, shared decision making and decision aids. These are all parts of the same overarching concept, personalisation and empowerment. I'm here to look at both sides of the story, to see what personalisation means from a patient and a healthcare professional's point of view.
Personalisation is a way of talking to patients so that it improves their confidence and so they feel better able to manage the condition themselves.
Personalisation is really looking at that one patient to see what makes them tick, to see what they do from day to day, how they would like to live, what they would like to achieve.
In our practice we've involved the whole team within this. Our nurses are doing some coaching with some of our patients. Our reception and secretaries are all involved because we feel it's so important.
I think personalisation is just talking to patients in a different way. I don't think it is that different to what we normally do. It's just a change in emphasis. So with some patients who are very, very ill, we have to make a diagnosis to make sure that they're safe, and that's really, really important. But with other patients who have a long-term condition and are responsible for looking after their own health, we need to help them feel more confident in what they do at home before they come to us.
It could be that somebody wants to get to the garden gate. As a clinician, that would not be my goal. It would be about their blood sugars, it would be about monitoring their oxygen levels, but actually we can join together in our goal to maintain him, to support him to get to his goal, therefore maintaining his own health, motivating him to keep himself well.
But do all patients want this? Isn't there a danger that patients won't feel supported and that some may even make wrong decisions, which could even lead to litigation?
All the evidence suggests that the more we involve patients in decisions about their care, the more we're open and honest about the pros and cons of different treatment, the less likely we are to be sued by our patients.
We're not asking patients to make medical decisions. It's not the patients or the health professional, it's the patient and the health professional. So they can make decisions about their own health. We can give them advice on clinical issues and areas of safety.
A few years ago when I was first diagnosed, it was like I was a different person, and I was sitting in a wheelchair with a blanket over my legs. I was told not to do too much, to pace myself, and I just looked forward to actually nothing. Now we look at outcomes, we look at how to get to those outcomes, and it's a two-way conversation. They can tell me the best about the medical side of things. For me, I can tell them what makes me happy. And so they've put two together, and that then makes my life brilliant.
How can we make sure that patients get the right information so that they can understand their condition and make the right choices?
There are a range of support services out there, organisations like NHS Direct and NHS Choices and patient.co.uk decision aid to help them make the right decision about treatment options, together with decision support. And the third sector, organisations like Diabetes UK, Arthritis Care, the Alzheimer's Society. And we need to use those more to support the patient in the majority of the time when they're not with a doctor.
When I first was diagnosed with MS, it was such a vast thing to learn about and to think about, and it was such a scary thing to think about. Although I gathered a lot of information in the beginning, I had to filter it to find out what was good for me, so it took a fair while.
It's excellent if people want to go out and find out about their condition and come in with printouts from the internet. And then we can have a discussion about what they've learned and what they want that is open and informed. We want to increase their responsibility by giving them advice when it's appropriate, rather than just flooding the patient with advice and they go away feeling that they're not really sure what to do.
Some GPs and clinicians might have their own concerns. Won't this lead to increased workload and increased costs?
I don't think that this will have necessarily a high impact on that, because I think it's about changing the way that we're working, not necessarily adding more in.
If a patient asks the doctor for a personal health plan, what we're not saying is the doctor has to then spend half an hour going through a plan with them. Personal health planning is an ongoing relationship, and it's an ongoing way for a patient to have more voice.
Initially, personalisation is seen to be very time consuming, but going on from there, you are reducing your time that you need to spend with the patient. The patient needs to spend within a medical environment, within A&E, within the GP, within physios, and they can increase their quality of life.
Frankly, the health service as we know it isn't sustainable. Currently there's about 17 million people in the country with a long-term condition. Many of those have more than one long-term condition. With the changes in the age structure of the population, health resources will become relatively more scarce. More than 80% of people with long-term conditions say that they want more support for self-care. And what we know is if we do that, they will consume far less health resources.
I've had this health plan for just about a year now, and looking back, I do see my GP less. It's made me think. I think I've got a headache, or I've got a tummy upset, or my leg don't work, and I think, shall I go and see my GP? Actually, can I do something else to make that better? Makes me think about what I'm doing, rather than just depending on going to see my GP.
I've found there are real benefits from this more personal approach. It gives patients with long-term conditions more control and responsibility for their health. By providing more personal advice alongside existing resources, staff can give patients the confidence they need to make decisions about the outcomes that they've decided. I've seen this approach isn't a revolution, but it's a change in emphasis, where patients and health professionals develop an ongoing relationship, working together to make better decisions. This doesn't have to mean extra work, longer consultations, or more money. In fact, by giving patients the confidence to manage their condition better, they'll have less need to visit their surgery or hospital. And as we've seen here, a better quality of life.
It's just fantastic. It makes so much difference to patients. It gives them a new lease of life. They're just new people, and their aspirations could be anywhere.
I'm not just somebody that sits in a wheelchair anymore. I'm not being pushed about. I'll go where I want. I do what I want. I think the good thing about what's happened, about the personalisation side of things, about me taking responsibility, I'm not depressed anymore. Small things make me happy. Going for a muckle with my Alf and having lunch makes me happy. He doesn't have to worry about how I'm going to wake up in the morning. I might not feel brilliant, but I'm not going to be depressed.
The personalisation has given me my wife back. It's made her not a different person, but her attitude to life is different. She's still the same old Sandy. She's more bolshy. I think now she's a far better person in her own way. She's more in control, she feels in control, and she likes her life.